you work or at least study on long-term care issues. I'm the hardest hit population in terms of the health crisis are the elderly, those who are probably experiencing long-term care. So, do you have any insight as to how this virus might impact long-term care in the long term?
Sure. I mean, this is a scandal. Over 50,000 residents of nursing homes and assisted living facilities have died from COVID-19. It was completely unnecessary. It was absolutely a scandal, and it was absolutely not surprising. Those of us who work in this field have known something like this was going to happen. We just didn't know when or how. Uh, Seasonal flu runs through long-term care facilities every year, and thousands of people die from it, and no one notices. The norovirus, which gets a lot of attention when it happens on cruise ships, happens routinely in nursing homes and assisted living facilities, and no one ever notices. So these facilities do a bad job in infection control, and what we now have is an extremely dangerous infection that's killing tens of thousands of people, and we're still not dealing with it. The real scandal is when this first happened in places like New York and New Jersey. We saw what was happening. We identified the problem. It wasn't fixed, and now it's happening again in places like Texas and Arizona and Florida. Exactly the same problem. We know we can deal with it. The solutions are well known. It is regular testing with rapid results, so we know whether or not aides are bringing this into the facilities, which seems to be the problem. Really good quality personal protective equipment and masks, which the facilities are still not getting after 5 months. And then just better infection control practices, better staff, better training. That's not happening. And we have to pay aides more. What's happening with a lot of these aides is they work multiple jobs. So even if one facility is doing a good job at infection control, these aides go and they work a second job, either at a different facility or they do private duty work, and they bring it in. And because the testing is so bad, they'll be asymptomatic. People may not know for a week whether or not they had it, and by then it's too late.
So before I let Bob jump in, Howard, is this a failure at the federal level? Is it a state by state issue? Is it private corporations? How is it that we know this is where the most significant issue is, yet we're failing to address it?
So nursing homes are like defense contractors. They're businesses that operate almost entirely on government contracts. They're paid either by Medicare for the skilled nursing post-acute care they do, or they're paid by Medicaid for the long stay residents. So the government's paying, and the government could say, we're not going to pay you unless you meet certain quality standards. For years, the government says it does that, but it doesn't really. Regulation is divided between the feds and the states because states do a lot of the actual on-the-ground regulation and inspections. You get exactly the kind of variability that you'd expect. Some states are very tough on these facilities. Some states let them literally get away with murder. But you know, the facilities argue that they need more money, that the reimbursement rates are not high enough. I think that's certainly true with Medicaid. It is not true with Medicare. To give you some sense of it, a nursing home is typically reimbursed about $500 a day for a Medicare post-acute patient, and it's reimbursed about $200 a day by the states for a Medicaid long-term care resident. So, you know, if you got a choice between getting $500 a day from Medicare or $200 from Medicaid, which are you going to do? And which patients and which residents are you going to pay the most attention to? Well, probably the ones you get the $500 for.
I agree with you 100%, 200%, if that would be possible, that the issue here is fighting the virus. You can't do all of those things are not going to do anything, even if you get them 100% right, if we still have people afraid to go out of their homes and or go to school, travel, get on business flights or whatever. So looking at that part of the bills that they've been sending out, what's your sense of whether the funding has been adequate for just the basic frontline business of battling the pandemic?
So I think it's two problems. One of them is the funding problem, and clearly the funding has been insufficient. You know, I'm as critical of nursing homes as anybody. You could say the same thing about some hospitals, but the reality is they don't have the resources. I hear story after story where facilities have to go out and negotiate in the private market for example, these N95 masks that you hear about. And these masks that used to cost $1 now cost, you know, $8 or $9 or $10. And the money's got to come from somewhere. So part of it is the funding, but more of it, I think, is the lack of any kind of a coordinated government response to this. This took an aggressive effort to organize the testing, the personal protective equipment, the norms that people should have maintained throughout this, and none of it happened. And frankly, you know, not to get partisan about it, but frankly, it's because you've got a president who insists that this isn't a problem. And when it starts there, you're never going to get a coherent, well-organized public health response. The public health doctors can talk all they want about what to do, and we've all been hearing for 6 months now about the need to wear masks and the need to do social distancing. But when the President of the United States says these are not important and this isn't really a problem, people are going to respond. You know, if you give people a choice between doing something they don't want to do, which is wear a mask and stay at home, and not visit with their friends and not go to the bar, or on the other hand, tell them everything is just great, there's not a problem, what do you expect? Any behavioral psychologist will tell you people are going to go for the one they want to do. And that's what's been happening.
Yeah, and I think it has an effect on the credibility of the response, or it bleeds back into the negotiations over how much you're going to spend on this, because if you can't say what you're spending it for, if you can't present the public and both sides sort of agree on this is the strategy and then we're going to fund this strategy, then the funding looks arbitrary. And in some sense, it is. It's just sort of like,
at this
okay,
point,
you
it's nothing
say
but arbitrary. We're like, here's the number. Let's just go from
here's
there.
the number, and let's argue about it like we're negotiating the price of a condo.
Right.
And I think that really gets at the lack of a basic overall strategy underlying this problem.
I think that's right. You know, they can't really even agree on what the overall purpose of the money is. You know, are we doing just economic relief for people, or are we doing stimulus? And those are two very different things,
right,
that require very different solutions. So the CARES Act, the one that was passed back in March, was a little bit of both, but it was mostly relief. It wasn't really intended to induce demand, which is, you know, normally what you do in a recession. You know, you give consumers money, they go out and they spend the money. Companies have to hire people to produce the stuff that people buy, and that gets you out of the recession. That's the normal playbook. But in this case, as you say, Bob, you know, the problem was people weren't consuming, not because they didn't have money. They weren't consuming because they were afraid to. And then they weren't consuming because the government told them they couldn't, because it was closing a lot of the places they went. So, you know, I've never seen anything like this. I don't think anyone alive today ever has seen anything like it. And it requires something of a two-step economic solution. The first one is providing the relief. The second one is providing the stimulus when it's appropriate. The problem is when businesses have to continue to stay shut because the pandemic is out of control, all the stimulus in the world isn't going to get you out of this.